There is some confusion tonight over a veto by Arkansas Governor Sarah Huckabee Sanders on the final day of session. Despite lawmaker approval, the governor shot down a bill that could have made a difference for medical marijuana patients. 5 News reporter Kayla Davis talked to a cancer patient and a state representative who are questioning now the governor's reasons.
Cindy Moffitt was diagnosed with stage 4 mesothelioma last August. Since then, it's been an uphill battle towards recovery, working to shrink her tumors.
Started on my liver, and it spread to my ovaries and my uterus. So I'm on really strong, high doses of chemotherapy.
Because of her illness, she's often isolated.
I'm in and out of the hospital a lot. I have to watch, I'm isolated a lot because of my white blood count. Which keeps me at home and away from people, because if you don't have a good white blood count, you don't have an immune system, which means somebody could sneeze next to me and now I'm in the hospital.
And through her recovery, the medicine that often eases her pain is medical marijuana, but getting that medicine is difficult for her.
I try to make sure that there's not a lot of people in there because of my, immune system. I have handicap tags, but sometimes there's not a spot up front. It's difficult for me to get in and out of cars. Standing for long periods of time is very tiring and hard for me to do.
So when Moffitt heard the bill to allow drive-thru pickup was passed in the House and Senate, she was elated. But that didn't last after she found out Governor Sanders vetoed the bill, saying it would expand access for usable marijuana.
How does this make it more accessible for people? Because to make it more accessible to who? The patients that already have cards, that are already getting it, because the public still can't.
Co-sponsor of the bill, Representative Aaron Pilkington, says he agrees with Moffitt.
I'm confused as well because this doesn't increase the number of card holders, and it doesn't increase the amount a card holder can get.
I asked Pilkington if anything can still be done to help handicapped medical marijuana patients.
Legislatively, we have two choices. We can either wait till next session and try it again, maybe find ways to make the governor's office happy with it. Second one is we try to override the veto. But I think those chances are really small.
Covering news where you live, Kayla Davis, 5 News.